because I'm a firm believer to be one, you have to see one. So when I go into these schools and these young African-American men and women see that my hair looks just like theirs, my skin complexion looks just like theirs. Now, I'm not going to the prep schools. I'm going to those schools where they're forgotten about. I'm going to those schools and saying, hey, you can do this because I was you. I see myself in those students. Don't do something because it financial aspect. They print money every day. Find your purpose. I believe a lot of people are doing things because, it pays me, or this is what they said I should do. Do what makes you happy, and the money will come. I don't want oral health to be a luxury. I want it to be something that is done because it needs to be done, and us as a society and as hygienists and dentists, we can do that. We can take care of that and not say, hey, I need $1,500.
A tale of two hygienists.
Dental hygienists and dental people, welcome back to another episode of A Tale of Two Hygienists podcast. I am your co-host Dave, and I'm here with Jess, my amazing co-partner. Jess, so something interesting happened to me today. I was looking at a patient, and because it's the summer, they're younger now. So all these kids are coming in and coming to the dentist, and they were like, hey, so what is your name? And I found that very interesting because I was like, I wear my name on my scrubs. But I learned that they don't teach cursive anymore. So
They can't read it.
my patient was not able to read my name, and it was like borderline Daniel, right? They call me Daniel, but I was like, buddy, this means David Torres. So for listeners, if you guys are out there thinking about buying a new pair of scrubs, maybe consider just getting it print if you're trying to engrave your scrubs. Just a little public service announcement, because that's exactly what happened to me today.
And like maybe next to your CRDH say no cap
No
or like
I
Riz.
like that.
So
I like
then
it.
they'll be like, yeah, now I really get you.
That's it.
Yeah.
Relate more to
So
them. I love it.
yeah, so you guys are probably hearing our guests. So before we move any further, Jess, tell us a little bit about this amazing person that we have on with us today.
We have a guest that's dripping with Riz. Dripping. Woo! Dripping. We have with us today the one, the only Richard Robinson. He
Let's
is a
go.
dental hygienist. Let's go. He's nonprofit founder. Let's go.
Let's
And a community
go.
advocate dedicated to improving oral health outcomes, expanding educational opportunities, and creating greater diversity within the dental profession. Let's go.
Let's
This is like a
go.
rare opportunity that I'm in the minority here. Like this girl dental hygienist with these dental dudes.
Yeah, these hygienists.
Yeah, the guy
Dennis.
Yeah.
The guy dentist.
Richard is the founder and executive director of My Why, which is a nonprofit organization committed to serving underserved communities through oral health education, outreach, and community engagement initiatives. He's a graduate of the University of Arkansas for Medical Sciences, College of Health Professions. Let's go, Hogs.
Let's go. Yes.
And
Yes.
then Richard is passionate about inspiring and mentoring future healthcare professionals. Through My Y University, he leads workshops for students who aspire to become dental hygienists, providing guidance on educational pathways, professional development, and career opportunities within the field. Guided by the mission of inspiring the next generation of dental hygiene professionals, the program focuses on increasing awareness of the profession, breaking down barriers to entry, and creating a more diverse and representative dental hygiene workforce. Whoop, whoop. Richard also established the Richard Robinson Scholarship at UAMS to help dental hygiene students overcome financial obstacles and achieve their educational goals. Through his leadership, advocacy, and commitment to service, he continues to empower future dental hygienists, promote health equity, and strengthen communities through education and access to care. Welcome, Richard.
Thank you so much. Thank you. Thank you so much. That introduction, man, it's such an honor. Thank you again.
It's an honor for us to have you here. I'm really excited to be led, to be empowered, to be promoted, and to be strengthened in the next 30 minutes. I just wish it was a little longer. We'll have to have you come back.
Heck, we'll do it. I'll do it. Yes, yes.
Richard, I'd like you to start a little bit about how I love part of the intro when you said to break down the barriers and financial obstacles to
Yeah,
entrance of dental hygiene.
yeah.
Tell me a little bit about your own story there. I feel like there's something to tap into.
Yeah, so I grew up in a non-traditional household, single parent household, on the other side of the tracks, you might say. I didn't find dental hygiene until I was 40. So I went back to school as a non-traditional student. But not only as a non-traditional student, I was a student that suffered from severe dyslexia and ADHD. So a little tidbit here, I didn't learn how to like read fluently and comprehend till I was 36 years old.
Mm.
Wow.
Yeah.
Okay.
And a lot of people don't
Sorry.
know that.
So I'm looking at also you listeners, you guess. I mean, you probably look him up, but I'm like looking at you. I'm like, how old are you, bro? Because you are reverse aging, man. That-
You
that's
know, blood don't crack, right? Come on now.
I'm feeling my age.
yeah.
So I'm
As we
actually,
speak, Jess is
go ahead.
reapplying sunscreen. Maybe she's in store.
Yeah, growing up, we didn't have the opportunities of going into hospitals, going to those workshops and into those like different events that the hospital holds for different high school students and things like that to get that exposure. So when I found dental hygiene, I was getting my teeth cleaned one day, and I didn't even know they were called hygienists, to be honest. And so she was telling me about her experience, her work-life balance, and just making it seem just like I need to do this, because I was in between jobs. So after I finished getting my teeth cleaned, I called my wife and I was like, babe, I want to clean some teeth. And she was like, you want to be a hygienist? I was like, look, whatever that lady does, that's what I want to do. And so we made it make sense financially, and we found a school here in Little Rock, and the rest is history. I became a hygienist and just became passionate about the profession and giving back to the community. The things that I saw as a student going into school-based programs, that the kids were not educated on the importance of oral health. They didn't have oral health kits like toothbrushes. Their siblings didn't have toothbrushes. The adults were not educated behind the why we need to brush twice a day, floss, preventative care, things like that. So that really sparked everything for me to create my why after I graduated, along with, a scholarship, because after I graduated, I found out I was the second African American man to graduate from UAMS since the program began, I believe in
Wow.
74. So we can clap, that's Black history right there. We can clap for that one right
Yeah.
there.
That's a long
So
that's a
yeah.
long time
Yes,
to not
yes,
have that representation.
exactly.
Richard, I love guests like you because honestly, we as hygienists, we make a difference every single day. And sometimes we don't know how we're doing it, right? And the fact
Mhm.
that you got so inspired by the lady cleaning your teeth, right? By the hygienist, and you'll be able to walk out and be like, babe, we're gonna change our lives. I don't know how we're gonna make this happen, but we're gonna make it happen. And
Yeah.
being able to kind of like make that career shift because you have that belief system and that purpose. And as luck will have it, of course, now you not only did you graduate and created history, but you continue to do so even beyond the dental chair, right? And so I wanna double click a little bit more on that. I want to be able to talk to you about the thought process that most of us, I mean, we go to work, we see our patients, we're in the chair, we're in dentistry, we're doing all of the things, and then you went beyond that. Tell me more about that. Tell me your why.
My why. So, I mean, after graduating, I always want to give 120. And as one of my professors said, he said, you can graduate and be a gum gardener. You can go to work, clean teeth, and leave. Or you can be an indispensable hygienist. And that's what I wanted to be. I wanted to do more. I wanted to give more. So I was lucky to find a office that only required me to work 3 days a week. And I'm like, wow, you're going to give me 4 days off? That's more than enough time for me to make a difference in my community. So that's when I started the nonprofit, started going into these schools, educating the next generation of dental hygienists, having these students and these classes see themselves in me. Because I'm a firm believer, to be one, you have to see one. So when I go into these schools and these young African American men and women see that my hair looks just like theirs, my skin complexion looks just like theirs. Now, I'm not going to the prep schools. I'm going to those schools where they're forgotten about. Their textbooks are outdated. Their chairs are outdated. Their recess equipment, is outdated. I'm going to those schools and saying, hey, you can do this because I was you. I see myself in those students.
How lucky are we that, well, how lucky are those students, right? That they're able to kind of witness that. Man, you're giving me goosebumps, man. Because honestly, I think we all have. I mean, the listeners listening to you, hear you talk, it's so hard not to get that passion and that motivation, right? And I think that even just what you just said, I was like, wait a minute, I can make a difference in 4 days, and I get one off. And I feel like hygiene is hard. So at the end of the day, we want to kind of like maybe stretch and relax and unwind. But you're like, no, 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 let's go make something bigger happen, because you have
Yes.
this vision and this passion, the ripple effects that you can create just even by having an organic conversation. That's so exciting. And I want to give you I want to give you props for that, because honestly, as a male hygienist, I tell just this all the time. My class, when I went to hygiene school, I was one of the first guys. There was only three in total, and we're a big group. We were 46 people. And when I walked in, I honestly thought I was in the wrong class, because there was no other guys. But the fact that you're able to come out and be able to kind of be that beacon of hope, that change is not only created, but you also could be part of the change as well, is extremely exciting.
I love that you took the opportunity to pay it forward, Richard. You're like, "Hey, I'm noticing that I don't look like everybody here." And Dave's like, "Hey, I'm noticing that I'm not, this maybe not be my spot." But instead of saying this isn't my spot, you said, "Hey, this is my spot, and I'm going to do more with that and provide opportunities for other people to find their belonging in these spaces." What steps did you take to make that a reality?
Just looking at the numbers, just inspired me and encouraged me. Like, there's less than 4% minorities doing what I do, and less than 1% African American men who do what I do.
Mhm.
So, like, let's bridge that gap, right? Let's get these young African American men and women and minorities in this profession, and let's get them in the right spaces and places. And that opportunity is not always given to people who look like me. So how can I get those people in the room, get them in front of the right people, and the right professions? Because growing up, I just thought everybody in the hospital was a nurse or a doctor. I didn't know they had respiratory therapists, physical therapists, dental hygienists, things like that. So it was eye opening to me as I became an adult. Like, oh, there's other jobs here, besides nursing and someone being a doctor. So I'm like, I bet these other young students don't know that there's other opportunities out there. So not just with dental hygiene, getting them involved in other health profession careers, opening the door. Just real quick tidbit, like, one of the students who I went to speak with, they were a senior last year, and I went and spoke to their class, and I saw them at our local college here. And I was like, hey, I was doing a health fair there. And I was like, I think I know you. She was like, yeah, you came to my school with the big red toothbrush, because I carry a big red toothbrush. And she said, you inspired me to become a nurse. So she's currently a nursing student. And she was
That's
never thinking about
amazing.
going into anything in the College of Health Professions. And she's like, I'm in my first semester here at the university. I'm staying on campus. But she let me know that I inspired her, because no one came and talked to her and told her that she can. It was always, you can't, or you're not good enough, or you don't belong, or you're not going to make it. I'm everybody's biggest cheerleader. Everyone. If you tell me you're going to do something, I'm like, let's do it. When we're going to start, let's write it down. So that's just me all day, every day.
Richard, have you always been like that? Or is it something that you're gonna get the energy because you had like one little win and then another one and another one, right? Or is it something that since you were a kid, you had like this, I don't know, mindset or type of way of looking at the world?
You said it. It's the mindset. Like, it could rain outside for 10 minutes, and 90% of people would say it rained all day and they couldn't get
Mhm.
anything done. It's just 10 minutes. You can still do your rest of your day. But people will sit there and say, it rained all day. I have to sit on the couch all day and just do nothing. You threw a whole day away because it rained for 10 minutes. Or you
See
can
that
go to work and
And
say,
how
hey,
long did that girl see you with a red toothbrush? Like
30,
10
45
minutes?
minutes. That's
Yeah.
I did a presentation, 30 or 45 minutes.
34, and what you can do, the mindset of seeing something with a short amount of time and changing that into something that's beneficial. I keep on going back to your experience with your dental hygienist and your appointment time, and how that is such a small appointment time, and the mindset of you in that moment of taking that opportunity to be like, "Oh, hey, this is something that I can do," and then expanding on that. That's is there something that she said or did, or what was going on in your mind that you were like, "Hey, this is what I want."
The area that she had, this was her space. The work-life balance. I have an 18-year-old daughter now, but then she was a lot younger, so I wanted to spend more time with her. And I wanted to spend more time with my wife because but then she was a bedside nurse, so she worked like 3 on, 2 off. So the schedule was just real crazy. So and I was everywhere with my previous employer as well. So we never got to spend that quality family time together. And her excitement about the profession, about, hey, I get to educate, I get to do this and do that, and we have conferences. And I'm like, this sounds exciting. I wouldn't even look at the financial aspect of it. I just wanted to go to work and be happy. I see so many people going to work every day and leaving work and they look miserable. And I'm like, I
Mm.
don't want to be that person. I want to enjoy what I do. And I don't even look at it as a job anymore or a career. Right now, to me, this is a hobby. They just pay me for it. And so when people are like, hey, when you go to work, I was like, I never work. This is my hobby. They're just sending me a check every week or every 2 weeks. And they were like, wow, that's a different way to look at it. And so when I go to work, I'm that guy on the highway bumping Taylor Swift on my way to work, having a great time. And I leave work feeling the same exact way. I'm not exhausted. I'm not hurt. I'm not broken down. Like, being at my place of employment energizes me. And again, it all goes back to the mindset, how you view things. If you want to change something, you can change it. But nothing changes if nothing changes. And that all starts with
What
you. Go ahead. I'm sorry.
No, you don't be sorry, Richard. This is a conversation. What advice do you have, or how do we get out of that rut? How do we encourage each other? Because you're a bubbly personality, man. If I was working with you, man, we'll be partying it up. You know what I mean? Like it will be maybe too much. But is there something that our listeners right now are maybe driving or working out or just folding the laundry that they can take away from this conversation that says, here's how I'm going to shift my mindset? Is there specific advice that you have to kind of get them over that hump of them feeling like they're in a rut, maybe?
Yeah. Um, I I would say find your passion, find your why. I will let them know, don't do something because it financial aspect. They print money every day. Find your purpose. I believe a lot of people are doing things because, oh, it pays me, or this is what they said I should do. Do what makes you happy, and the money will come.
What
Find
is
your
it
why.
about dental hygiene that makes you happy, Richard?
Educating, meeting new people, hearing backstories. I'm extremely empathetic. So when patients come in, I let them know that their feelings are valid, that this is a safe space. I don't want them to feel intimidated. I know the dental office could be an intimidating, place to go, but just like, hearing wins from my patients and hearing challenges and, following families, but like, they have a newborn 4 years ago. Now their kid is walking and talking and starting first grade. So every hour on the hour, it's a different story. And I want to hear that.
It's one of the very few professions that people allow you into their personal space. We
Absolutely.
are we are able to to have a physical, like, touch their face, be in their bubble, and I
Hmm.
think that that creates a connection that we can leverage for good, that we
Yes.
can create a space where people feel heard and inspired, and I think the secret sauce of prevention is that it's a partnership with your patient, and when you can support the habits that they have that are improving their health, we really can make a much a difference far beyond what we can see.
Absolutely. Absolutely.
Uh, can you paint me a picture of what really matters for like oral health care, maybe in the system, and what it could look like, and be honest about how far we actually are from it? So, like, if you're doing all these outreach in the schools, you're representing out there. I would argue you're doing a lot more than most, right? What are some of the things that we're still struggling with out there, or maybe that you would love to see if there was a richer verse?
Oh man. First things first is more autonomy for dental hygienists.
Ooh,
Um,
ding, ding,
w-
ding, ding,
we
ding.
we need more autonomy. I believe, in Arkansas, I'll use Arkansas as an example. We rank at the bottom of the funnel when it comes to oral health.
We do.
And it's the reason because we have a lot of rural areas here in Arkansas where they don't have hygienists and dentists. If you allow hygienists to get in those communities and actually provide services to those patients, but also educate them and then provide them with a dental home and say, hey, you can go here to get service. I'm going to get you clean today. We can go from being at the bottom of the funnel to being to the top. So all that lies into collaboration, working with not only dentists, but hospitals as well, collaborating partnerships in the community, the churches, the schools, more school-based clinics, especially for those underserved communities, getting more hygienists to want to volunteer their time in those underserved communities, as part of a school program, whether that be dental or dental hygiene or dental assisting. you know, we have one event that we hold here every year in Arkansas, but it's one event for the entire state. And people come from all over once a year to get a tooth pull. So there's no telling how long that tooth has been hurting and giving them
And we
pain.
don't want to pull teeth. We want them to stay in the head and we want them to be
Exactly.
healthy and happy. And so the prevention,
Exactly.
guys, man.
So it's all about prevention and educating and, and starting it off young because a lot of those kids, when they come and I do workshops for them, they're like, I'm going to tell my mom and dad, I'm going to tell my sister and brother, and that's what we need, and let's make it like a nationwide thing. We had the whole, I'm going to say like the DARE program. I'm giving my age right now,
You're
and that was
speaking to the choir.
and
Was
that
the
was in every elementary school. And you had there for 2 or 3 years in elementary. Why can't we have an oral health program like that? What if we can catch these kids at a younger age and saying, hey, brushing your teeth is cool. Flossing is cool. Just like they said saying no to drugs was cool, right? And have a nationwide program like that, starting them off young, and then have more workshops as they get older and opening the doors up to this profession.
I like your dreams. I like this Richard verse of prevention. But you're already doing that. You are already creating spaces where this is happening. Tell us a little bit about that.
Yeah, so our newest initiative is My Wide University. It's a hands-on workshop where we take 10 high school students and we have a 4 to 5 hour workshop. It's like a crash course of the dental hygiene program. We started off with our mission, our oath, and then we have a white coat ceremony.
How fun.
Yes. And then after the white coat ceremony, we go into the curriculum, radiography, case studies, tooth morphology. We cover 4 different aspects of the dental hygiene coursework. And then in between that, we have a lunch and learn. I'll bring a financial advisor in, or I'll bring someone to talk to them about something related to what's going on or their next steps in life. And then after that, we have a graduation and they come walk across the stage and then our parents are there and they get a graduation bag along with a certificate. But we're also opening their eyes because we have instruments, so we're doing instrumentation. We're looking at radiographs, we're looking at case studies. I'm getting them involved so they actually feel like they're the hygienist going over a case study. And I have some amazing My Y volunteers. Shout out to Team My Y that always come help out, from here. And not only here in Arkansas, I have a location. I have one in South Carolina, in Beaufort, South Carolina. I started that one last year. So we're actually in 2 states right now, and we're just doing amazing things.
And this is to inspire this group to then pursue a degree or a path in medicine, in dentistry, that
Yes,
type of a awesome.
yes, yes. And not
How
only
cool.
that.
How cool is that? Because we talk a lot in this podcast about access to care and legislation and all the changes that are happening. But oftentimes we need a person like Richard to kind of go back to basics and say it just takes a community outreach for us to get local students, high school students, and go through the whole like what it's like to be a day in life, right? I cannot think of more of a day in life than what you currently are doing and inspire those students. I graduated quite early, but in this high school that I was allowed to be a dental assistant as well at the same time, and that was why I fell in love with the smell of a dental office. As weird as that sounds, it worked for me, and here I am
You
becoming
like that clove? You like that formaldehyde? You like that?
yeah. I was a weird kid and I was so excited, but I can only imagine like all these kids that are just going through this like amazing journey that they're taking with you. And that's amazing. Do you have a story in mind of a student that got their certificate or their parents that was like, you changed my life? Do you have one in your back pocket?
Yeah, so there's actually a mentee I have of mine. She's actually currently in the program. But before she got into the program, she reached out to me. And before she was even my mentee, she was just like, hey, can I come in and shadow you? I've seen your work on social media. My name is said person. And I've been applying to this program for 3 years and I haven't gotten in.
Mm.
Can you help me? I'm like, absolutely. So we met, we had coffee, we looked at her grades, we looked at, what she's done like volunteer wise. I, worked with her. I was like, hey, have you been to any of the open houses? She's like, no. And I was like, well, have you been to any, to the clinic to get your teeth cleaned, to let the instructors know who you were and how passionate you are? No. And I'm like, oh, okay. So I'm writing all this down and I'm like, okay, I got a plan for you. We're going to this open house. Matter of fact, you're going to every open house until the program starts. I don't care if it's the same thing, the same professor, you're doing the viral and you're doing the in-person. And we're going to get our teeth cleaned there. And we're going to network with the students and the instructors. And you're going to resubmit your application and you're going to do your observation hours with me. And I'm going to write you a stellar letter of recommendation. She did all of that and she was waitlisted.
Whew! Ouch!
She called me bawling, crying. And I was like, no, it's going to be okay. She's like, what do you mean? I didn't get in. And I'm like, just give it some time.
Yet.
Exactly. So after a month and a half of waiting, she got the phone call and she called me crying again. But these were tears of excitement.
Man, some of my favorite students were the ones on the wait list.
Yeah.
They come in with such a different perspective and a drive and
That grit.
a grit. Yeah.
Yeah. That chip on your shoulder, like, hey, you didn't want me for 3 years, but I'm here now. Now it's time for me to dominate. And she is doing amazing. And she'll be graduating next year.
Well, that's awesome.
Oh, I get goosebumps, man. This is every podcast. I feel like I get some goosebumps. And here's the thing,
Richard
man.
bringing the goosebumps and spades.
Yeah, man. From a dental cleaning appointment at a later on stage of your life to basically inspiring the next generations of hygienists. Tell me about what's next for the next 10 years for you. If you were to close your eyes, because I don't think you ever like woke up one day and was like, I'm going to create this amazing Richerverse, right? But
Right.
if you had the opportunity, if you need help, if you had the resources, what would that look like in 10 years from now?
Oh, man. Oral health wouldn't be separated from medical health.
Right.
It's the full body. I don't know who wrote the rules, but we can change that. We really can change that and say, okay, head to toe, it's medical. I would like access to care to everyone, not just those who are financially able. I would like more resources for those in those underrepresented communities, more dental offices. I would like more education in our schools when it comes to oral health, and that's across the board. I don't want oral health to be a luxury. You know, I want it to be something that is done because it needs to be done, and us as a society and as hygienists and dentists, we can do that. We can take care of that and not say, hey, I need $1,500, knowing you're a struggling single parent and you're going to work in pain, and then you have to go take care of kids. Why are we living like that? I want to change all of that.
I want more Richards. I want more Richard Robinsons. So that's what I want. And I hope, listeners, as you hear his words and you think of yourself in your office or wherever you're practicing hygiene, know that one interaction can create another Richard Robinson.
Absolutely.
So remember that, and thank you, Richard, for being with us, and thank you for the impact you are having on the future.
Thank you all for having me. It's such a pleasure.
Oh man, you are the definition of like on purpose and drive to work, man. Thank you for what you do. And we're going to leave your information in the show notes in description. So if people ever want to support, reach out, ask questions, please reach out to Richard. He is not only making a change in our dental hygiene world, but he's literally driving and making change in people's lives. Thank you, Richard, for what you do.
Thank you. Thank you. What the kids say, clock it, clock it.
Clock it.
That's a wrap on today's episode of A Tale of Two Hygienists podcast. If this conversation made you feel seen, inspired, or even just a little fired up, share it with a fellow hygienist or fellow dental professional. Share it with your neighbors, your friends. Share it with everyone. That is how this community grows.
Make sure you subscribe, leave us a review, and connect with us on social media so that we can keep on going with this conversation. Remember, your career, your voice, and your story matter here. We're David
and Jessica.
And until next time,
keep learning, keep laughing, and keep showing up for yourself and for each other.
This has been a production of Endeavor Business Media, a division of Endeavor B2B.